Hi, welcome to the Destin Business Forum, brought to you by the Destin Area Chamber of Commerce. I'm your host, Amy Perry, with the law firm of Pleat, Perry, and Ritchie. Our next guest is Dr. Tom McKnight. He's the founder of the Emerald Coast Health Institute. Welcome to the show.
Thank you very much. Very glad to be here.
Okay, tell me what the Emerald Coast Health Institute is.
Basically, it's a medical clinic. It's kind of the culmination of 30 years of being a board-certified family physician and 10 years as being board-certified in preventive medicine, having wrapped up a long career in the Air Force, and really sitting back going like, now, how can we go forward versus sitting back and going like, you know, when do I play golf again?
Sure.
And really looking at now the law that we have in the country, we have with Obamacare, it's our law. So how can folks really navigate through the process of the greatest change we've ever had before in the medical arena? So the Emerald Coast Health Institute is really not just I take care of all that we do as family docs in an outpatient setting. It's also to take a little bit more time to say, but let's look at your optimal health plan. You know, it's kind of like a business plan or a financial plan. How many people really have the time with the physician to sit down and say, well, let's look at it all and put it all together and have a timeline to see how things are going?
That's very unique, because usually when you go to a doctor, you're in a crisis, your ear hurts, your heart hurts, you have pneumonia, you know, something, and no fault of the doctor, but they're going to try to alleviate the stress or the pain that you're in, and you really don't have that time to talk about the future and do any kind of planning.
It's difficult, and honestly it's going to get even more difficult with what's going to happen in the future. There's projections for fewer doctors. There's projections for 75 million people becoming Medicare eligible. So we have a lot going on within the system, and really it's going to come back down to the individual in terms of, well, what can I do for myself and my family? You know, before things get into a crisis. I mean, I take care of chest pain, I take care of folks with cancer, so those are folks I always want to care about. But can we go upstream to the problem? Can we really push the envelope and get back up before things are really going awry, if you will, into the crisis mode?
It seems like to me, I'm not an expert, obviously, but it seems to me that a really great way to get a handle on our medical crisis is preventative stuff. You're located, your office is located
We're
in
Blue Water Bay.
Okay. And I've got a couple of notes about what you do. Family medicine, sports medicine, non-surgical, and then preventative medicine. And we talked a little bit about that. Do you set out a plan, a 3-month plan, a 6-month plan, a year plan of what someone can do if maybe they have a history of diabetes in their family, or they have a history of obesity? They're not there yet, but they have this history. Is that the type of thing that you look at?
In many ways, yeah. Most folks who are boarded in preventive medicine really end up in a lot of health departments and so on. We've been trained in biostatistics and epidemiology, so population-based. When I was in the military, I was at a headquarters type job where my job was to oversee a population of 50,000 in terms of their promotion. So on that side of the things, that's a population approach. So part of our goal at the Institute is to really say, we're in this community. How can we really get into the community and help people, whether it's speaking to groups about prevention for educational purposes. And then when you get into the clinical setting, I tend to think in terms of, if I see a 35-year-old person, I say, well, now, Mr. Smith, here's the way I see you for just a second. So what, I said, well, when you're in your 50s and 60s, if you're going to have a heart attack, that's kind of when that happens. If you're in your 70s, that osteoporosis kind of kicks in then, because that's when the bones get a little brittle. You break the hip. You know, when you're in your 80s, that's that Alzheimer's thing. So almost looking ahead at when do the certain conditions or diseases strike people the most, the goal is to say, but you're 35.
So what
can we do to think about those? And let's talk about your family history, let's talk about your lifestyle, let's talk about your nutrition. So there's an opportunity to really think ahead, hopefully to impact that outcome in a way that's positive for the person.
You know, I'm sure a lot of doctors would want to do that, but if you actually focus on it, you're probably going to have a better chance of doing it, like at your place. I know there are a couple of other things that you do. Obesity management. Tell me what that is.
I've taught at 2 different residencies in the Air Force, and at the second residency I really kind of came to a threshold of going like, you know, I'm so frustrated with my patients who are obese, and the diseases that kind of go along with that, the gateway, if you will. And so I kind of asked the question to myself, was there anything we can do about this? Or are we kind of like stuck with? And so the Air Force was kind enough to say, well, we'll give you a couple of years to go figure it out when you do your preventive medicine and so on. So I really did sit down and look at the literature and try to look at what was effective. And first off, came up with the reality that it is controllable. Not easy, but it is doable. And that's really the first step. Is this doable? And if it is, then how do we create within the family medicine clinic, based on 15 or 20-minute appointments, a gradual but cumulative process that helps the patient get control of the disease? Because when you talk about chronic diseases, Amy, it's really about, do I control the disease or does the disease control me?
Yes, just that question right there seems almost determinative of the outcome. If I think my disease controls me, then what am I going to do?
A lot of times, hear patients say, well, in my family, this is the way we are. And I'm going like, well, is that where you want to stay? And some people say yes, and we'll love on them anyways. That's our job. We will. However, if they're going like, but do I have a choice? And that's kind of what the Emerald Coast Health Institute is about, is trying to say to people, can we have a choice?
You do have a choice, and you can make some change.
And it's a little bit different of a clinic. In family medicine right now, the buzzword is the patient-centered medical home. A lot of people have heard that. And frankly, what that helps us do as family docs is to stay focused on the patient. But when I step back critically and look at that, I'm going like, but does the patient have control of their health? Or do we have almost too much control, even though we're focusing on them? And so what we talk about at the Institute is the patient-controlled medical home. In other words, what can we do to give you as much control over your health? For example, we have a patient portal. You know, to me, I would not ever think again of holding on to the records. You know, when you go home at night, you can log in and you can see your medical record. If you go to an emergency room, you can log in. If you're an elder person and you're in Florida and they're up in Pennsylvania, if you give them your ID and password because they're concerned about you, they can see how things are going. To me, that's technology helping us.
That is such a, I don't know if it's a new thing. It seems like it's a rather new thing. My grandfather was a doctor, and everybody in our family just thought, you know, Granddaddy knows everything. He'll solve everything. But he didn't tell us a whole lot. You know, here's some medicine, here's some exercises, whatever. But he was put up way up on a pedestal. I think doctors have terrific training, and they do know a lot that we we non-doctors don't know. But I think it's better for the patient if they have that communication and that information. So I think that's a really neat thing. There's one more thing. We're almost out of time, but tell me what andropause is.
As people age, women, we hear a lot about perimenopause and menopause. It's kind of like the silent one out there, like heart disease for women. You know, February is cardiac for women's heart month. Well, men actually are going through the same changes in terms of their own hormonal changes, and primarily testosterone. And certainly we see the commercials on TV about medications that are available. But we don't know why they're available and what's led up to that. And we focus on one area of it. But in reality, there's many, testosterone affects many parts of our body. And so my goal is to help men understand, here's where you are physiologically, and here's where you can be, and so we go from there.
And that study is andropause. That's interesting. I could ask you a lot more questions, but we are
out of time. Think of menopause with an andro.
Meno with an andro. I gotcha. Okay. Thank you so much for coming, Dr. McKnight. Like I said, I could ask you many, many more questions, so I hope you come back sometime.
Okay.
And I wish you success in your new practice.
Thank you very much.
We'll be back.